I mean, I think that there are a few suggestions during the hackathon relevant to rare disease within nephrology, and I believe one would be sort of based on the imaging sphere, where we do need better ways of imaging really at the molecular level what's happening during disease pathogenesis. I think another area is that we need better ways of modeling rare diseases in nephrology, right? And we can make better use of organoids and iPS cells. And I think some of these efforts are in their infancy, but they will be quite useful.
You know, one issue in terms of going back to what patients are experiencing in the home would be some kind of video mechanism where physicians, or not just physicians, but the whole care team can see what patients experience on a day-to-day basis. So, you know, if a lot of these diseases might have some kind of physical disability component, you know, how does that impact the patient at home? Or if a lot of these diseases end up having something like chronic pain, what does the patient experience? Like, what are they able to do on a day-to-day basis? And how can we better understand that? Which right now, when we're seeing them once in clinic or twice, even if they come to clinic regularly, we still don't get a good idea of that because we're not seeing what they have to live through. And then the other thing is connecting patients to each other. So some of these patient advocacy groups will have support groups or support meetings, but again, a lot of these patients are spread out across the country, and so they're very isolated, and they might not physically be able to meet other patients. They might have joined online Facebook groups, things like that, to connect, but nothing really beats the face-to-face interaction and sharing stories in that way. So some kind of tool to help patients connect and be able to see each other.
One needs a way that families or physicians who are non-experts but have questions could readily get to a bank of experts who have that expertise and can address it. How you set that up so it's effective, so that the expertise who are not vast in number are not constantly being barraged with questions that other physicians could handle or other care providers could handle, would be maybe a little bit tricky, but there must be a technological way to get at that problem.
I would like participants to think of the kidney as this interface of health and disease, and also as a source of understanding what's going on inside the body. The kidney can give us insight about what's happening in the cardiovascular system and digestive system, but it's also the secretion of factors and toxins can tell us a lot about what's happening. And I think that's a very under-tapped resource that we would have a lot of access to. And I think that also having a system that can mimic the filtration unit will provide the signaling molecules that may also be collected in the urine and give us further understanding about what may be happening in the body. And it may not just be kidney specific, it may be somewhere else. I think that would be an interesting angle to take.
Maybe just one thing to add here is that, you know, again, because we are a rare condition and there are, let's say, maybe a dozen places in the US that really specialize in this condition, and then I would say another few dozen perhaps worldwide. Having the infrastructure to be able to, again, study our patients in the same way. So I'm particularly interested in looking at long-term outcomes in patients with these cancers. And I find that every institution has a different institutional registry that they use to be able to keep track of their patients. And so when doing research, it can be challenging because my fields don't necessarily correspond with another center's fields, and certainly not with a third center's fields. And so if there was some way of creating large-scale database registries that would enable sort of in real time us to be able to enroll patients quickly and have them all in a unified central location, I think would be something that's really helpful. We've seen this to a certain extent in Europe, where they have a lot of centers that specialize this, but this is not something we have in the States, and I think that it's something that would really fill a need there.
So one thing that's come to my mind a lot with my particular population is they're disabled by their disease in more than one way. In my experience working with people with disabilities and working with the medical community around disabilities, they tend to think of it just one at a time. So you might have an ambulatory disability, or you might have a hearing challenge or a visual challenge. My particular patients have more than one. They're all legally blind. And then in addition, many have very significant respiratory symptoms. And one of the challenges we face is we get them the equipment they need around their respiratory symptoms, but they can't read the devices that are related to those. And so one idea I've had is, wouldn't it be great if there was some technology that we could bring to bear that would benefit my patients in terms of their visual disability as they grapple with the other challenges in their lives?